So we are thrilled you've been able to join. My name is Joya Delgado-Harris. I'm Executive Director of CEO Cancer Gold Standard, and I've been in this role for about 10 months. And in this role, I work with all things Gold Standard, and we are really working on a new partnership as well called Going for Gold. I'll talk more about that in a moment. But we're really happy that you have taken time to join us today, and that you found it important to join our Elevating the Importance of Healthy Workplaces. See what I did there? There may be more of that, but I'm really glad you've been joined us. We have a really great panel of folks with a lot of expertise and understanding and background with Cancer Gold Standard, and I'm really excited to introduce them in a moment. This is a webinar. It's I think our fourth of our Accelerate Health content series. We started in January, and if you've been able to join those, fantastic. We're thrilled about that. If this is your first time, thank you, welcome. A quick glance at our registration list earlier, I noticed that there are a lot of people that are Gold Standard companies that are here, which is fantastic. There could be some of you that are here that are thinking about Gold Standard and why should I do this, and why is this important? And whether you're here, have been a Gold Standard company for a long time, or you're new, we welcome you. And I just wanted to take a few minutes before I introduced our panel to kind of level set and explain who we are and how CEO Roundtable got started, and some of our programs. So if you don't mind me taking that moment, I think it's important to help. Like I said, I've been on board for about 10 months, and I've learned something new every day to really help me understand what we do and how we do it. And CEO Roundtable on Cancer was started in the early 2000s by the late President George H.W. Bush. He and his wife Barbara lost a child at the age of 3. She was 3 to cancer, and it was a lifelong mission of theirs to help reduce the burden of cancer. And it is a public health concern. So he started some programs, a national forum, also Sea Change. And in 2001, he started CEO Roundtable on Cancer, which is really bringing together CEOs and giving them a call to action to do something more about cancer prevention and diagnosis and treatment for their families, as well as their corporate families. And born from that was our CEO Cancer Gold Standard program, which is a workplace wellness accreditation program, and really has some pillars from health education and navigation to prevention and early detection, accelerating treatment, survivorship, and well-being. So those 2 pillars, the 1 and 5, are we call them our bookends. They really are applicable to any health condition. And then the 3 pillars in the middle are oncology focused. So overall, it's looking at the comprehensive care. So this Gold Standard accreditation helps employers really evaluate their corporate, their culture of health in their corporation and how that can be enhanced. So it really provides a nice tool. Also, Project DataSphere is our digital library laboratory, if you will, that provides one place where the research community can come together and share and integrate and analyze data from academic and industry phase 3 cancer clinical trials. So that's our arm. And like I mentioned earlier, to go back a little bit, from Gold Standard came Going for Gold. Really excited about this partnership with historically Black colleges and universities and Hispanic serving institutions that will take our Gold Standard Workplace Development Program and use that framework to apply it to campuses. Of course, colleges are workplaces, so we want to be able to apply the Gold Standard framework to faculty and staff. But additionally, with Going for Gold, we want to be able to integrate students, alumni, and the communities around the school to be able to have strategies and activities to help health outcomes, and by so doing, help enhance health equity. So it's a lot going on, but really great programs that we are excited about, and collectively we are doing some good things to help reduce the burden of cancer, and we're coming together, approaching it from all angles, really, from corporate, from academic, and really trying to make sure that we are helping address the burden. So wanted to share that as a level set moment. And now we can hear from our panel because it's really important that we bring their perspectives in. I'm thrilled to introduce Adam Pellegrini, who's co-founder and CEO of Jasper Health, Dr. David Shepperly, who is Executive Director of Occupational Health for Bristol Myers Squibb, Evan Tillman, who's Director of Workforce Wellness at MD Anderson Cancer Center, and Barbara Powell-Jackson, who's Goal Community Engagement Coordinator and also an adjunct professor at Shaw University. And each of their perspectives will be amazing. And it's a nice lens to look at gold standard because we have companies like MD Anderson and Bristol Myers Squibb that have been gold standard accredited for some time. So thank you all for joining. That was a long overview of who we are, but a quick introduction of who you are. So when I ask the first question, please feel free to give some more insight into you and or your organizations. But I love that you all represent large startup, academic, health providers. So I guess, Evan, I will start with you, with MD Anderson being our accredited since 2007. Please feel free to share more about yourself, but also how has MD Anderson utilized gold standard data or outputs or within your organization and been able to identify areas of change or make any change using that data?
Yeah, no, thank you so much. Pleasure to be with everyone. Again, Evan Tillman. I am recently promoted to the Director of Workforce Wellness at MD Anderson. I've been with MD Anderson for almost 6 years, so very happy to be here and to share our experiences with the CEO Gold Standard or about the CEO Gold Standard program. So at MD Anderson, we really utilize the CEO Gold Standard framework as just that, right? As a framework to ensure that we are providing the very best programs, evidence-based best practice programs. And I have to be careful not to get into the weeds about all of the great, honestly, great programs that we do offer, and try to stay more high level. Maybe that's another talk for another day. But we really use this as a framework to look at and I'll kind of talk about those bookend pillars, but to look at those 5 pillars, specifically the first and the fifth one as it relates to employee health and well-being, and make sure that our model, our Be Well model is comprehensive. So in our holistic program, which is Be Well, we have an 8-dimension model focusing on everything from sleep health, financial, and of course physical and nutritional health, but 8 dimensions, and it seems to be growing every month. But we're utilizing the best practices and the resources and the communication, the data that's coming out. So when we can ensure that we are offering our employees the very best, like I said, the very best programming, cutting edge information and resources. So that's how we've been really able to leverage this great partnership since 2007.
Very good. That's helpful. Thank you, Evan. Dr. Shepperly?
Hi. Afternoon, everybody. Pleasure to be here. My name is Dr. Dave Shepard. I am the global lead for occupational health at Bristol Myers Squibb. And just to give you a little background on Bristol Myers Squibb, we are a biopharma company. We have about 40,000 employees located globally. Our focus is really on developing medicines of unmet need. And our primary focus is in oncology. So as you can see that we really pair up real well very closely with the Cancer Gold Standard. So much like what Evan just talked about, we've really used the evaluation of the gold standard as a way to look at our well-being programs and that we're delivering and try to see how we can best improve upon them. So let me just give you a few examples of where we actually use this, the gold standard to kind of help us in that initiative. So I'm going to actually start with back in 2016 when we actually initially applied for the gold standard. You know, being an oncology company at the time, we really had designated smoking areas. And so being able to use the gold standard application, as well as the fact that we're an oncology company, allowed us to really drive and convince our leadership team that we needed to be smoke-free. And we did that on a global basis. So every Bristol Myers Squibb site across the globe is smoke-free. Additionally, as we went through the initial application, we used it to kind of look and figure out how we could support our employees and their families. And one of the things that we realized is that we needed to do a little bit better job in supporting them when they're in the battle of cancer. And so we've done a number of things. We've created an internal cancer support network for our employees and families. We've actually, in our SharePoint site, created a one-stop shopping information center where employees can see what benefits they have, what clinical trials are available, the cancer support network, everything that's related to them so that they can help fight this illness. And then finally, we recognized that we had a lot of great wellness programs or well-being programs around the company, but they weren't connected together. And so this helped us to drive our well-being strategy, which we call Living Life Better. And now we have 348 well-being champions in 31 countries that we've used to drive our strategy and our well-being program. So utilizing the gold standard application has really helped us to kind of understand the strengths and the opportunities that we have in the well-being programs that we're delivering to our employees. So thanks, Joya.
Yeah, I love that. Thank you for sharing that, both of you. And I love, Dr. Shelby, how you were able to say that what you learned from gold standard, we're able to keep doing, and what you're able to modify. Because sometimes we're doing great things, but if it's not connected or not serving as well, we don't know unless we have this type of framework. So thank you for sharing that. And then I'll look to Adam. He's the most recent, I think, gold standard application finisher. And so Adam and Barbara Powell-Jackson both can speak to this from what they, how they anticipate utilizing gold standard data. So Adam, I'll turn to you first.
Perfect. Hi, Adam Pellegrini, co-founder and CEO of Jasper Health. It's a digital oncology company. I have been doing worksite wellness, I think, since the late 90s, before there was digital, I think it's safe to say. My first digital health initiative, I've been doing digital health as an industry since it started, since 2000, was building out cancer.org for the American Cancer Society. And one of the first initiatives was worksite wellness for the American Cancer Society. And it was very apparent to me that everyone had some really great interventions and some high ROI opportunities, but scaling that in a consistent way across the country and around the world was difficult. And that was one of the challenges we tackled at the American Cancer Society. Since then, I've gone on to lead a lot of these initiatives for Walgreens, CVS, and Microsoft, and ended up saying to myself, where is my passion? My passion is in building the same capabilities we know we need to help cancer patients navigate a turbulent, the turbulent rapids of treatment and remission, and do so for employees and their caregivers in a way that's scalable, it's easy, and it's empathetic. We see a lot of, in Jasper's mind, the 5 pillars really speak to this idea that we need to focus on psychosocial support. We need to see how we can scale empathy for those that are fighting this horrible disease, and honestly, how we see folks every single day have challenges that some of us may never even fathom. Jasper has over 13,000 newly diagnosed employees, patients on our platform that we help every day, and some of the insights we see are shocking. Some folks don't even know they qualify for Medicaid. and they're living homeless in a car, and they'll call us or they'll chat with us because they have a free phone, and we'll say, well, doesn't Medicaid help you with that? And they say, what's Medicaid? And the pillars and the gold standard, we literally, our platform is built to support all of the 5 pillars, because it's the 5 pillars are what is needed. It's just, it's so powerful. Some of the insights real quick that we've seen from our 13,000 patients are employees and patients and caregivers, their top concerns may not be what we think they are. Naturopathic medicine and remedies, diet and nutrition, the ability for caregivers just to reduce the stress and have more time so they could spend more time with their family and automate some of the mundane. Those are some of the top things. Mental health, how can I afford my medications? We typically see in the oncology space, we tend to focus on solving the problem clinically, but the psychosocial wrapper around those clinical protocols is so critical. And that's why I'm super passionate about the gold standard, because it really does focus on those psychosocial elements that are truly missing and what patients, caregivers, employees, members are looking for every single day. So I'm very excited. We're very new to it, but our whole company was truly crafted to make sure we can address the 5 pillars of the gold standard.
It's fantastic. Thank you for sharing that. And thank you for your history. I actually worked at the American Cancer Society for almost 10 years before coming over here. And your work, it lives on very much there, and it's very helpful. I'm also a very grateful 14-year breast cancer survivor. And when you hear those words, if you hear those words, where you go for information, you just go. You just want to know what you can do. How long do I have? How can I help myself? All of these questions just flood you. And so, thanks to you for what you do and for helping cancer patients navigate this journey. And I'm saying that thanks to all of you all on this panel, but I'm saying this because of the work you did on cancer.org. And I also, it reminds me too, that that's the beautiful thing about the gold standard framework. When you go through the application, there's a nice list of resources that are from different sources and are there to help provide people with the information they need to answer the questions and to help provide that information to their employees and their corporation. So thank you. Thank you. And Barbara Powell-Jackson, I'm thrilled to introduce you because you're at Shaw University, which is one of our first HBCUs to commit to go for gold. And I know you're still working through the application, but you have ideas aplenty, I know, and a lot of passion. And I think you've already spoken with somebody over at Jasper Health. So please introduce yourself and talk more about how you see gold standard being implemented on Shaw University's campus.
Thank you. Good morning, good afternoon to everyone. I am Barbara Powell-Jackson. I am the Gold Community Engagement Coordinator for Shaw University. As you know, Shaw has a history of being a pioneer in the community as well as in the field of education. So it is just so just an honor to represent Shaw. We are downtown Raleigh, North Carolina, in the middle of a great community. And what I found to be just so rewarding is that to have the support, it's kind of from the collegiate side versus just a company. You're dealing with education, and then you're looking at the employer side, because it is a business, it is a school. So you do have the human resources side of things, and looking at how making sure that the benefits that are selected are great support of all of the pillars of cancer awareness, and bringing very much just information. Where can you go? What resources do we have? What tools can we use? And then when you're looking from the collegiate side of the population of the community, how do we get our students rally around it? How do we get them to support? And then listening to their stories. Some come where they have people at home that have actually endured or encountered, serious disease. And it's like, hey, what do we do? How do we share this with you? What do we build from here? So what I found to be very much, one, because I have the support of Dr. Paulette Dillard, which is our illustrious president, and then my dean, Dr. Lynette Wood, which is the dean of school, the Business of School and Professional Studies, that has kind of entrusted me to take on this opportunity, this journey, and it's like just looking at going through the application, at first I was like, are you guys serious? You know, are you serious with all these questions? And you really need for me to differentiate this from that, because it's kind of like two-sided. Again, you're looking from the university side as being an employer, right? And then you're looking from the student side, the population. I'm like, wait a minute. But what I found to be just so rewarding is to go through and to look at what we already have. And we're building initiatives from that. You know, we have kind of sort of, you know, I'm looking at how can we kind of unite and partner with what we have on campus, organizations such as our MAPS, which are the Minority Association of Pre-Medical Students. So it's like, hey, how can we kind of partner with things that are already there and not reinvent, but still put the emphasis and the focus on cancer awareness and other health disparities in the community. You know, we are downtown Raleigh, and we have, again, we are a community that has encountered a lot of health disparities. So this has given me the initiative and the drive. And again, like I said, with the support, we're building the wellness for all. We're taking, you know, to put some actions and events and activities. And of course, if you can look at my background, we have a 5K that is going to be the main event for next week, which we're all excited about, on March 30th. So if you're in the area, definitely register, come on and participate with us. But it's a 5K, it's a cancer walk that's going to put Shaw out there as we embrace, empower, and educate the community in which we serve and which we are part of. And then with you guys partnering with us, it's only going to make it better in sense of, you know, providing tools and giving other resources as which cancer patients, survivors, and families can just embrace. And, you know, we're looking to build longevity of life, you know, forget the short lifespan and being the fear and having fear kind of consume once that, you know, that word happens to hit the ear. So that's what I'm about, and that's what I'm here to support.
Well said, well said. Thank you, Barbara. You mentioned a couple of things that I caught, well, a lot of things that caught my attention, but you mentioned Dr. Paulette Dillard, and I know that with the Going for Gold program, we have gotten the buy-in, the support, the let's do this from the presidents and chancellors from each of these schools. And so that leadership from President Dillard, from Dean Wood, all of that is critical to the success of this program. Similarly with CEO Roundtable, it's a group of CEOs that when they say this is important to us, it trickles down, and it makes everyone know, whether it's a corporate setting, an academic setting, that this is important to our leadership, and therefore should make employees feel valued and feel like the company cares about me and my health and the health of my loved ones. So it's good stuff all the way around. Thank you for that. I just wanted to kind of go back to Adam for a minute. You did a great job, Adam, of explaining what Jasper Health does. And I love some of the things you got into, but can you talk more about some of the data that Jasper Health has uncovered, maybe a little bit more specifically about, we all think about the clinical criteria, but also talk more about what you uncovered with that.
Yeah, it's really fascinating. You know, we have a list, a top 10 list of top 10 to-dos that patients, what we consider our patients members, because cancer doesn't define you as a patient. So our members put in what are their top to-dos and what are their top concerns, what are their anxiety triggering concerns. And it is eye-opening. I mentioned a little bit of the interests, but some of the to-dos are also eye-opening. You would think, well, I want to make sure I take my medication, and I want to make sure I check this or talk to my doctor about this. The top to-dos in Jasper are watch a movie, right? Walk my dog, spend at least 1 hour with a loved one. It really, what you find is, when you empower members and their caregivers to reduce some of the mundane tasks of healthcare, because no one really wants to think about, I need to, you know, make sure I remember my shot and I need to remember my chemotherapy. That what they want to do is try to automate some of the clinical things, reminders, so that they can actually make time in their lives for those things that are intrinsic in value to them. And So what we started to do is build out programs like meal programs. How to, number 3 is, how do I eat healthy during treatment? You think that, you eat right, you have your salads, but when someone's going through treatment, that doctors would know more than me, but they could have mouth sores, they could have really hard time swallowing. So there is a complete sort of regimen around how to eat healthy, how to eat okay during treatment. And then when you flip to remission, we found that 12% of our members signing up for Jasper, it's free for any consumer coming from anywhere can sign up for Jasper for free. What we found is 12% of them are in remission, and they have the same concerns in remission as when they were newly diagnosed. Except for the one thing is, when's the shoe, they're worried that when's the next shoe going to drop. So if you think about the entire span of newly diagnosed all the way through in remission, you have different psychosocial concerns that span all of that continuum. And oftentimes we have actual nurses and social workers that take phone calls and do video chats with our members. And what you'll find is, one, sometimes someone just needs an ear, and someone will actually ask our nurse, "Can I just talk to you about not cancer?" And our nurse will say, "Absolutely. Let's talk about pets." Or some folks are coming onto our platform that are late stage and are really lacking in hope. And what is there to be hopeful about? Clinical trials. You heard about David talking about a central place for clinical trials. So we'll match them to clinical trials with an empathetic approach. Again, I want to make sure empathy comes, because you can't digitize all this stuff. It's one thing we found at cancer.org was you can't digitize the entire experience. You must have some type of human interaction for that empathy to make sure folks know, cancer is so serious and it's so emotional. You don't want to just have a bot do chat bots with you. You're not booking an airplane ticket. So when you do things like, we found a trial for you, the hope index that we saw on Jasper skyrockets. Mm-hmm. Now, whether it's going to work, whether they're going to match and go all the way through, that's part of the process. But we had one member say last week, "I was depressed and suicidal on Sunday. You matched me to a trial. I now have hope, because before that, what else do I have to look forward to?" And it's those moments that we need to be able to scale for our work sites and be able to, and it addresses other conditions as well. Our number 3 medication that a member puts in is a statin. What does that tell me? It tells me that cancer is a serious disease, but there are other diseases underneath it that folks are managing as well, diabetes, CHF. So the pillars, the bookend pillars, I think, Evan was talking about this, that could span the entire space of chronic disease prevention and management. And cancer as a serious disease can really also be a point where other diseases can actually be impacted in a positive way from an outcomes perspective, because they are now, a patient or a member is now looking at the holistic part of health. And so I think there's it's not just, we're addressing cancer in the work site, but we're addressing chronic disease, serious disease in the work site. And we think that the seriousness of the disease can actually help drive better health outcomes.
Excellent. Thank you, Adam. That's super helpful. And it's so, psychosocial aspects are so critically important. And I don't think we forget about them, but we certainly, thinking so much about that treatment, that understanding, and with empathy, I love how you say that, the other aspects that go into the journey is so important. So that's, thank you for that extra insight about it. And then I'm asking you this, but anyone can answer this. Can you talk more about the ways that MD Anderson has, how your accreditation impacts your patients, maybe for, for example, eliminating smoking, which is really hard on health system campuses, believe it or not. But, I know you all did that, but what are some ways MD Anderson has utilized that accreditation?
Well, no, I mean, and yes, absolutely. And to your point, we were able to use this. So I joined MD Anderson in 2016, I believe. Through this accreditation, with the backing of this accreditation, we of course are a tobacco-free campus, but it was that push and that extra backing that ultimately led to the entire UT system being tobacco-free as well. So over 120,000 employees, campuses spread out through all of Texas. So that made a huge, really went a long way in positively impacting workforces across the state of Texas and the patients in some of those medical centers that are also under UT system. I do want to elaborate because I did a terrible job up front of not providing enough examples. It's okay. You have to shake your head, but I do.
I didn't think you did.
No, well, that's okay. I should have said more. In looking at or providing some examples of really how we've utilized the data, and to Barbara's point, our wellness program, we are built on collaboration. Looking at we have so many incredible experts throughout this institution, throughout this system, but we partner heavily with our cancer prevention center, with our community wellness initiative, our Be Well, Healthy Be Well communities, and we're taking this education material that we're providing to our employees, to their family members, and we're taking that out into the communities, and we're sharing that. We're sharing that has given us an opportunity to share what we have learned from the CEO Gold Standard accreditation, and to be able to provide our experiences, how this has helped, this accreditation has positively impacted us, and then speaking with other smaller organizations in some of our communities within the Houston metro area. So collaborating with our tobacco treatment program, employees assistance program, spiritual care and education. This has really allowed us to connect those dots, to Adam's point. It's holistic. I could talk more and more about how holistic and how much, this has really allowed us to improve. I wish we had 300 plus wellness champions. We're about 270, I believe, right now. For 22,000, our goal was 300 by the end of the year. But taking this education, we take a customized, personalized approach to our wellness program here. So we provided wellness grant opportunities for teams to apply to, much like the criteria for application here, they're having to answer some questions and provide that deep dive and try to connect the dots on what resources we have available. But we take like I said, a customized approach, and we want to offer, of course, the health education, the general broad wellness programs, but it's more about offering our workforce members at the department, the division level, really programs that are meaningful and impactful to that particular group. So again, we can talk more about that another time, but this is really, it's given us that framework and allowed us to really improve our wellness grant application and the questions that we ask when we have one-on-one conversations with teams about their wellness goals and direction they'd like to moving forward.
That's fantastic. I think customized approach is key. It's nice for people to feel, like I said, we want patients or people to be their own best advocates. And so knowing the questions to ask, having the tools, and having your employer help you through that is priceless. I was going to mention, Barbara, you said something that made me think. Oh, Evan, you said something about wellness champions, and it made me think about our Going for Gold program, and that we are integrating students. Most college students are not thinking about cancer, but too many of them know someone who has been impacted by cancer. And as we deepen and cultivate our partnerships with each school and create metrics around how this program will look at the schools, and it will look different at every school by design, because every school has different assets and resources and capacities. But as we do that, what we may not ever be able to quantify is those wellness champions, those students who have become ambassadors. They're not medical, but they might go home and say, hey, mom, isn't it time for your mammogram? Or, hey, Aunt Jean, isn't cousin Johnny 13? Has he had his HPV vaccine? I mean, those are the kinds of things that we hope to get out of this, where we're heightening awareness and helping people understand, even at college age, when that may need to be top of mind, what they can do to help. Maybe strategies at schools that we can quantify. Maybe our students that may not be thinking about cancer, but they are thinking about risk reduction activities, so we can help them think about that. Healthy eating, diet, nutrition, and physical activity, and those types of key activities that they can do and share and gently nudge their friends. So those are the kinds of activities that we hope to implement on campuses. I'm kind of all over the place here, but I have so many questions. Dr. Shepperly, can you share more maybe about Bristol Myers Squibb and their global, I know you went global gold standard accreditation in 2020. So I want to hear that. And I also want to shout you out for your work on the Health and Wellbeing Council after you've answered that.
Okay, thanks. So Evan, we're trying to get more well-being champions. And it's always a challenge from that standpoint. But, you know, as I mentioned earlier, you know, I talked a little bit about the fact that we looked at all of our programs in the initial application. And what we recognized was that, you know, not only are we, you know, we're a global company. So probably we have 18,000 employees here in the US, but we have, you know, almost 20-some thousand employees that are located around the globe. And we really wanted to be able to make sure that we deliver our Living Life Better program globally. And so we started looking at how we do that, how we would apply the gold standard on a global basis. And the biggest challenge in reaching out and getting global is doing it in China. And that's kind of the first step. And if you can get over that step, then you can kind of go through the rest of the world. And we have a very capable well-being champion over there who had developed a program that was culturally sensitive and appropriate for the folks in China. And you may think, well, you know, knowing some of the Asian countries and their proclivity for smoking, that might also be a challenge. They actually were the easiest to convince to go to tobacco-free. It was kind of an eye-opener for us that when we talked to our colleagues in Japan and China and said, look, we're pushing forward with the gold standard, we're doing it on a global basis, this will require you to be tobacco-free, they were like, that's great, we'll do it. So that was good from that standpoint. And then once we got through the China application and got accredited there, then we were able to apply our program, our Living Life Better program, and use that to be able to apply for a global standard. And again, as I mentioned earlier, it's kind of helped us to drive across the globe our Living Life Better program. So it's been a great journey, and we look forward to our reaccreditation and reevaluating our programs through the new application, which I know was what you want to ask me about next, right, Joya?
Well, yeah. I just wanted to acknowledge your work along with your colleagues' work on the Health and Wellbeing Council. You know, there's a lot of work that goes into making sure these questions are, I know, Barbara, you mentioned there are a lot of questions, and that's by design, because everybody hears things differently, learns things differently. And so that's why there are so many questions, but the questions are purposeful. And I know Dr. Shepperly, along with Dr. Otis Brawley, Dr. Ron Getzel, Dr. Targino at Johnson & Johnson, worked really hard to make sure that these questions are evidence-based, that they are comprehensive. Before I arrived in June, we'd already started going through a gold standard application refresh. So I was able to come in on the tail end of that and just be in awe of the work that had been done. to make sure the questions were on point. But just wanted to ask you, Dr. Shepperly, what if there's any insights or what considerations, what evidence, I guess, does the Health and Wellbeing Council consider when they're developing or amending questions?
So yeah, no, thanks, Joya, and I really credit Mary Elizabeth for bringing us together to relook at this application. And initially, you know, when you thought about the gold standard application, was one that yes, you got the advantages of being able to take a look at your programs, but it was okay. We did that, and then there wasn't a lot of feedback, and we felt like we wanted to create something that was a little bit unique in the application. And there's many well-being applications, you know, accreditations out there. And we wanted to create something that was a little bit more unique in the fact that not only do you apply and you go through the questions, but there is an opportunity for a panel to review it and then to provide you as an applicant back feedback on where you might be able to improve, what your strengths are, and for taking a look at some of the, you know, the programs that are really outstanding, and maybe we can utilize that to kind of help other organizations as they're on their quest and journey from this standpoint. So, you know, we had you mentioned all the physicians that were involved in it, but we had academics, we had those of us from industry, and we were able to kind of pull in a number of the, you know, papers and take a look at what we could do to develop this. And I think where we really improved and changed this was in the last section around well-being, and it was really looking at how you develop that culture in your organization. So it's more of beyond just the physical health, there's financial information, there's environmental, we're looking at mental health, we're looking at volunteerism. And when you think about well-being, you think about it, there's multiple ways that people engage in well-being. And I think Evan talked a little bit about this at MD Anderson, that you know, people engage in different ways and how they impact their health. And so if we can touch people in those ways, then, you know, that may help as they are preventing cancer or dealing with cancer in their lives. And so that was probably the biggest significant change in the application. And I think it was, it's really to try to help people engage in their health in a unique way. So thank you for the question.
No, thank you. No doubt a lot of work, and we appreciate you and the team making the application what it needs to be. And also thank you for crediting Mary Elizabeth Rich. She is our president of CEO Roundtable on Cancer. And I want to acknowledge also Therese Martin, who has worked very hard to make sure that the application is what it needs to be and helps provide other resources. So we're definitely a team here, and cannot do it without our Health and Wellbeing Council members and our Life Science Consortium members and all the folks that help us. While I'm mentioning people and chatting, I don't know how many Going for Gold ambassadors might be on the phone too, but I'm really thrilled to have our Going for Gold ambassadors team together. They're helping us work with and acquire our historically black colleges and universities and our Hispanic serving institutions. They have all heard what we're trying to do. They believe in the mission and have immediately sprung into action to make sure that we are gathering schools and people from the schools that will help us manifest mission. So I'm really thankful to everybody on the call who's doing that. So thanks for your leadership, Dr. Shepperly, on the Health and Wellbeing Council. As we wrap up and start to look to questions, please, I want to remind everybody, please put questions in the chat box. We'd love to get to everyone's question. I think we've kind of covered a lot here, but I will pose a question to the group. Don't everybody speak at once. But if there is anyone on the call or anyone who might be listening to a replay later who is interested in becoming gold standard accredited, but is on the fence or just needs another push or wants to be able to convey the importance to their leadership, is there anything that you would tell them, maybe encourage them, or just maybe any additional information than what's already been shared?
I'll take that one. I guess I'll start. So I know, right, Evan, you can come on too. But I would say, go for it, simply because it does give you an opportunity, with the 5 pillars to see where you are as a baseline, as a company. If you're looking at it from the perspective of your benefits, how much do you have? How many resources do you have right at your fingertips that you're not really aware of? So that opened my eyes in terms of the benefits as an employee, to know that there are counseling services, that there are extensions of, different services provided through my medical benefits that I really didn't know I hadn't tapped into. So it gave an insight, as well as, like I said, from the collegiate side. So what we did, it's funny and very ironic, Joya, that you had mentioned like the ambassadors. Through this, I have student ambassadors that are rallying around cancer awareness on the, with their peers. It's that we have adapted like the 4 pillars from the 5 pillars, for students, because we customize it with what population we're dealing with. So like avoid tobacco, be physically active, eat, look at what you're eating, and then limit your alcohol consumption. So then we also have now, as Evan was saying, like you guys have wellness champions, we have wellness for all that we're building from it. So I would say, this is a journey. It's not the destination. So the best that will come out of it, if you want to look at, is that you will definitely improve. The worst is that you will find where you are, and then you will find ways of improvement. And then you have a team of support that can help you, your university, your company, and your community. So I would say take a chance on it, because we're looking to, to make life in the sense of, to have longevity, not to have that short span. And in areas where you have health disparities, it's there to empower, to educate, because education is key. Knowledge is power. So once you can tell me, but if you give me and show me how to duplicate and how to be, feel better about myself, then you're giving me power to live. So that's why I would say, especially from an HBCU perspective, go for it and make the best of it. And then incorporate all the resources that you have, and everybody has to be accountable for it.
I mean,
Oh,
we could
that's
stop
amazing.
right there. That's perfect. No,
That's great.
Adam, were you gonna say something?
No, I was just going to say that's perfect.
Right.
Well, powerful. I think the one thing, it's something we did a lot of, Ron Gotzel actually, and Jeff Harris and others. We did a lot of work in the early 2000s around the return on investment as an employer for doing some of these things. We all obviously are very passionate about psychosocial health, empathy, making sure we deliver caregiving services. But there also is a financial benefit to an employer to really address all of these different gaps in care. 12% of an employer's costs can be attributed to cancer. And that's just during the treatment and remission, not including the things like the ROI around smoking cessation, which delivers $3,500 in savings after 3 years for every quit smoker. So you're doing what's right for your employees by using this tool to kind of look at your structural benefit design. It's almost like free consulting. You're doing what's right. You're doing what's socially responsible for your employees. And at the same time, you actually are addressing evidence-based interventions to reduce the total cost of care. So if you look at that as 3 layers, to me, it's a no-brainer. It gives you that guidance and that navigation to be able to address all 3 levers, make your employees, lives better, and impact your bottom line.
And I said that better either. Thank you.
So let me I'm going to add to what Adam just talked about a little bit, because, in this competitive world, there is opportunities in how you use your well-being culture. And so there are things like, we look at it like this is one way that we can help our employees become more productive, more engaged in the company, and as a retention tool. So there are a lot of advantages beyond just, and Adam talked about the ROI, but there are some soft advantages too when you're trying to retain and attract talent from that standpoint. And having that well-being culture really helps.
Exactly. Well said. So we have a question that's, I think, come in, and I'm trying to monitor this chat box. So loaded question. It says, if we're interested in going for gold, or achieving gold standard, would some of these panelists be interested in mentoring us in our effort? We got to,
Gotcha.
see,
Got it.
unanimous, yes, to whoever asked that. I think someone asked, is it possible I don't achieve gold standard for my company? It's possible, but it's not probable. I would answer that way. I mean, and gold standard accreditation is it's a journey. It's not a pass fail. We are here to help a company achieve gold standard. There are also baseline questions, there are bonus questions. So if you are answering at a minimum the baseline questions, which I'm very hopeful you will pass, that will get you through. So I mean, that's the best way I can answer that question. It's not likely that you will not achieve it, but we can certainly help you get there, and you will at the minimum identify what you need to do to achieve it. So go for it. But we are really here to help, and you saw all 4 panelists enthusiastically say they would help mentor someone. So please have at it. I really think this is gold standard framework is public health 101 at its core, and not in a basic way, but at its core. It's designing these questions around what we can do to help assure that the public can be healthy. And when we look at it from an employer, we look at it from an academic institution, I mean, it's just so many ways to utilize the information to help us move toward being our best selves as an employer, as patients, as employees. And so I really appreciate our panelists. If there's any more questions, we do have about 7 minutes left, or I can give you 7 minutes back. But I really just appreciate our panelists. And I think I learned a lot. I learn a lot every day. I am grateful for being here and being able to work in this way, because we all have a vested interest in eradicating cancer. But until we get there, what we can do in incremental ways to help people work through it, be their best selves, help their own health, help with risk reducing activities. That's what we're here to do, to help with making better choices and helping achieve this good health for everyone. So I don't think I see any other questions, but I just want to thank everybody for joining us. I want to really thank our panelists, the opinions, the lenses, the perspectives you gave were very helpful, and it makes me want to be a better employee and go out and do more. So thank you all very, very much.
Thank
Appreciate your
you.
time. Okay.
Thank you. And get out
Thank
to
you.
Barbara. Get out to Barbara's 5K.
Please.
I know, right? Yes.
Please.
come on.
Yes, and it's also virtual. It's virtual, so register.
There you go.
Yes,
We should
yes.
all be on.
Yes, please register, please.
Thank you. Okay.
Thank you,
Bye,
everyone.
everyone. Ciao.
Hi, everyone.
Bye.